Hi everyone. Today we're going to look at one of the things that can help out with lower back pain. And this is the kind of pain that you get across your lower back, not the one where you get pain down your legs. So you can use my standing body scan, which I've recorded before, and then the lying body scan. And just noticing your contact on the floor and how your lower back contacts the floor or doesn't. And take some time to do this because it's really important so that you can go back to that at the end of the lesson and feel the differences. So of course, if any of these movements increase your pain, don't actually do them, just imagine them. But it's really important that you do them very slow, very small and gently. If you do big circles or get stuck into it, your brain is just going to go on to its usual automatic pattern. And we want to break down that pattern and make it simpler and plainer and easier for your brain to do this. So really take your time and don't force anything. So lying on your back, have your knees drawn up. And slowly bring your knees over your chest and hold on to them, but don't pull them hard. Don't pull them close to your chest. Just have your elbows a little bit soft and your knees about hip width apart. And gently begin to make tiny circles with both knees going in the same direction, going clockwise first. And just focus on the sensations that you feel as you do that. You might notice that one circle is easier than the other or a different shape. Maybe it's not a circle at all, maybe it's a square or a triangle. But just gently play with these very small, slow circles. Notice how the pressure on the back of your pelvis changes and your lower back changes. And just explore. There's no right or wrong, it's simply noticing what you're doing and how it feels. And you need to give yourself time to do this. And notice your breathing as you do it. Do you hold your breath? Do you put your teeth together? What else is going on inside you? And as the differences become more noticeable, pause for a moment and then begin to do the anti-clockwise circle. And notice how that feels. Now that may change everything completely. The different leg might feel easier or the shape of the circle may change. What's it like when they both go in the anti-clockwise direction? And again, what happens on the back of your pelvis, and your lower back, your breathing? Are your eyes open or closed? You can play around with doing it both ways. And then slowly drop one leg down, just put your foot on the floor and the other leg and pause for a moment. Notice what you notice. Then bring your knees up again, get hold of them, don't pull hard. And now begin to take the knees in opposite directions. So one's going clockwise, one anti-clockwise. And how does that feel? What's happening in your hip joints? And doing it this way totally changes what happens in your pelvis. So pay attention to when your back comes closer to the floor and when it comes further away from the floor. And to the quality of the circles. Then pause and begin to take the circles in the reverse direction to where they were going before. And again, this may change things totally. Maybe you can feel the gentle rocking of your pelvis. And notice how far up your spine and maybe even up to your head you can feel that. You can take a lot more time to do this yourself, of course. So then put one foot down and the other foot down, pause for a moment. Notice what you notice. Then bring your knees up again, holding them softly. And now begin to play with concentric circles so that they're not going both in the same direction, but you're beginning to roll just a little bit from side to side, but staying within your comfort range. Remember, you're just exploring, you're not getting it right. You're just beginning to notice what happens. And then reverse that. Notice how the rest of your skeleton gets involved. Maybe your head begins to make a circle. If it does, which direction does it go in? Does your spine like doing this or not? Just maintain that playful attitude. And then when you've had enough, just put one foot down on the floor, then the other. Then drop your knees out to the side and slide your legs down. And take some time just to notice what you're feeling on the floor. That sense of your contact. Where do you touch? Where do you not touch? Is there a difference between the two sides of yourself? How does your lower back feel now? If you try to force it by putting your knees hard to your chest, you'll just get some resistance and pain, and then your back won't do anything. So when you're ready, draw your legs up, frog's legs again, and roll to your side. Come to sitting, and then to standing, and do another body scan. Bye.